Hello, everyone, and welcome to MedeAnalytics. My name is Greg Krantz, and I will be the moderator for today's session. Over the next 50 minutes or so, you'll be introduced to key members of our executive leadership team who will familiarize you with our company and vision. At the end, we'll have about 10 minutes to address any questions you may have. If you do have a question, please type it in the Q&A panel, which is in the top right of your screen. And be sure to ask the question to all panel members. And we'll get to as many as we can at the end of the session. For those questions that we don't get to, we will be sure to reach out to you individually with an answer. I'd also like to mention that we will provide a PDF version of this presentation at the end of the session. So be on the watch for an email with links to the slides. Now it is my pleasure to introduce our speakers. Paul Kaiser, our Chief Executive Officer, Scott Hampel, Senior Vice President, Product and Strategy, and Kelly Kroliski, Senior Vice President, Client Services. Now let's review the agenda for today. Paul Kaiser is going to give an introduction to MedeAnalytics. Scott Hampel is going to cover our vision, technology platform, and solution portfolio. Kelly Kroliski is going to discuss client services and cover Q&A. Now I'd like to turn things over to Paul Kaiser to get us started. Paul?
Hey, Greg, I appreciate the introduction. I am struggling to the presentation. Oh, here we go. Sorry, user error. Thank you for the introduction. A little bit about myself. Been in healthcare for 15 years. Got started at Cerner Corporation back in 2003, was there for about seven and a half years. Had the opportunity to go to TriZetto Corporation, was at TriZetto, which is, healthcare core processing care management for payers, as well as payer-provider collaboration and transactional routing from an EDI perspective on the provider side. Was there for about 7 years. We were acquired by Cognizant back in 2014. Got to enjoy some time with Cognizant before finding my way to MedeAnalytics. My healthcare journey has shown me all sides of the spectrum relative to the lens that different constituents look at healthcare from, which I think has been really, really valuable for myself in terms of the applicability of analytics in our space. And so really excited to be at MedeAnalytics and look forward to working with each of you on the call here. Professional passions, I actually, between Cerner and TriZetto, left healthcare for about 2 months. And within 48 hours, frankly, was questioning what did I do, and desperately wanted to get back to healthcare almost immediately. And so this has become a real passion for me. I love the challenges that healthcare presents, solving those kind of challenges with real tangible solutions that can be measured, and working with clients around what is the opportunities in front of them and how can we participate in helping them achieve those opportunities. From a personal perspective, I got a wife and 3 kids. As you can see in the picture on the screen, I probably outkicked my coverage a little bit. I feel very blessed to have the family that I do. To brag a little bit on my oldest, who in the picture here is 12 years old, on the left side, brown hair. She's a swimmer. Recently competed in the state championships in Texas. Broke a couple state records. Scored a enormous amount of points for her team, made a futures time, a nationals time, and really wowed us. Take a lot of pride in all of my kids. That was a recent event that is just so fun to watch one of them be so successful. So in any case, love my family, and when I do have, if I ever do have some downtime, my guilty pleasure is probably golf. So, look forward to meeting each one of you on the phone. I think what we would want you to take away from how we're presenting ourselves is I think that the team that we have built from a leadership perspective, and the culture that we're engaged with within our own 4 walls is really one of camaraderie, of healthcare passion, of supporting one another, and it's really a family environment, because I think each one of us as leaders sort of have that in our background. Greg, you want to go to the next slide? In terms of what brought us here today, in 2003, MedeAnalytics engaged with the advisory board in a strategic relationship in which the advisory board would white label and bring our technology to market under their brand. That business grew to be advisory board's Business Compass Analytics business. We had a very fruitful relationship for a long time and still have a great partnership with the company that acquired advisory board, Optum. After Optum acquired the advisory board, because of Optum's strategic direction and this very strategic client base to MedeAnalytics and where Optum's mind is at relative to who should support these clients and how we felt about it as well, we got together and decided that it made sense for MedeAnalytics to essentially acquire the advisory board's Business Analytics Compass business from Optum. In essence, we were acquiring the opportunity to service our client base directly and not have advisory boards sit between who the clients of our technology really are and the service model that could be presented to them. This is not new to us. We have been in business since 1994, had an extensive direct model in which we service clients very similarly to the advisory board on a day-to-day basis. So the transition should be seamless, both from a support model perspective as well as a technology perspective. There's no technology in which we're going to take you off of a system that you recognize to be something you bought from advisory board and put you on something new that is MedeAnalytics, because they're one and the same. So that hopefully what we've learned in some of the initial communications that we've had with clients is that was a concern, and it's, I think, a really strong story in that you don't need to be concerned. There isn't a migration to some other different technology. We are going to start servicing the technology that you are already on because it's ours. Hope that makes sense. In terms of the service and support model, like I said, it's very similar to the advisory board. The way that we're currently operating with the advisory board in terms of a transition is we have mapped out waves throughout this year, 2018, in which we are approaching groups of that Business Compass Analytics business with advisory board and transitioning them into our support model. I think the takeaway is that unless we're reaching out to you through and in partnership with the advisory board to start the transition conversation, really on a day-to-day basis, nothing has changed. We have contracted back with the advisory board for the year 2018 for our transition services agreement, in which they're going to help us maintain the client base as we take a very white glove approach to transitioning each client into our service model, and we hope that you feel that when we begin this transition with yourselves. Greg, you want to go to the next slide? In terms of who we are, as I said, we've been in business since 1994. We've always had a goal of helping our clientele leverage the insights from within their data to make even smarter decisions, leveraging those insights. Today, when we think about what differentiates us in the market, and Scott Hampel, our Chief Product Officer, is going to talk a lot about this, we really want to help our clients operationalize the insights from within their data, to create a high-performing environment that in real time or near real time is leveraging analytics to create a better result through smarter decision-making, both at the executive level, the middle management level, and down into sort of the production floor level at the supervisor level. And so we'll talk a lot about that strategy throughout this conversation. We're based out of Richardson, Texas. That might be, if you've known anything about MedeAnalytics, that might be somewhat new. Frankly, as you saw in my introduction, my wife and 3 kids, we used to live in Denver. When I was relocating to take this role at MedeAnalytics, my choice was to relocate to San Francisco, the greater San Francisco area, or which is where the headquarters used to be, or to Dallas, Texas. Richardson is where our office is at in the greater Dallas area, and it just made more sense from a family perspective for us to move to the Dallas environment. Since the CEO is in that office, we felt compelled to relocate the headquarters to Richardson. We still have our Emeryville office, which is across the Bay Bridge in San Francisco. It's a strong development office for us, and we will keep this office as it's very strategic to us. An interesting note, the location of our Richardson, Texas office is really strategic relative to its proximity to the University of Texas in Dallas. We have a very strong partnership with that organization, that educational organization around internship. We have a variety of interns that work within our four walls. The location of our office allows them to commute into our office, frankly, by foot. They can walk. And if you look at that associate base, almost 40% of our associate base in our Dallas office, which now is over 120 FTEs, was at one point an intern. So that's been a very fruitful and strong relationship for us, gives us access to really energized, curious talent that is passionate about analytics, and it's really moved the meter for us. Greg, you want to go to the next slide? In terms of the leadership team, I'm not going to go through a formal introduction of each person on the screen. I'll let Scott introduce himself and Kelly introduce herself. I think the general takeaway is there's 75 years of combined healthcare experience on this page. I do think I would feel compelled to introduce Tyler, even though he's not on this call. You will eventually meet Tyler for sure. He's an extremely talented Chief Technology Officer for us. He's got a vast array of both technology development and healthcare expertise in his background. He worked at Eclipsys for a long time. He helped transition Siemens Sorian to a place that Cerner felt compelled to buy it. He ran operations for Cancer Treatment Centers of America for a period of time. He ran the Microsoft Skype business in the UK for an extensive period of time, and that was really a precursor to how Microsoft Azure was leveraging or is leveraging big data. So he brings a vast array of expertise and depth to our team that I think is really extremely important. Kerry Martin recently joined us within the last 5 months from Cerner Corporation. He's bringing a lot of rigor to our sales approach in terms of how we engage prospective and current clients to ensure that engagement is delightful, if you will. And then we have Jim Hagan, our CFO. Quite honestly, we like to poke at Jim a little bit. He has just 555 days of healthcare experience since he joined MedeAnalytics. He's got a private equity background, CFO for a multitude of companies. Really, we're always oriented to the security side of the security industry. That has actually been very helpful for us, as you could guess. You know, as the fiduciary sort of holder of and responsibility over 80 million member records or patient records within our four walls, security is at the top of our list from a priority perspective. And so having some level of expertise from our CFO to bring into the organization has been helpful and fruitful as well. He gets the inherent need for security. You want to go to the next slide, Greg? In terms a little bit more about how we differentiate and do it at scale, I think when we talk with a lot of our client base, one of the biggest challenges that has existed for them from an analytics perspective is they made strong investments. Almost every client that we talk to have made strong investments in data warehousing, if you will. But when you poll them around, are you getting business value out of your investments, a vast majority of our clients, 95+% will say no. They hadn't been able to get business value out of their data warehouse investments. And really when it comes right down to it, in order to tap into the data warehouse and pull out the insights and put them in front of contextualize to users in use case format, you've got to be great at rapidly orchestrating enormous sums of data across a multitude of disparate data sources, bringing that data together, joining it so that you can perform analytics across it and present it back to the contextual user in a use case-based form so that they can get true business value. And that's where we really differentiate. We do it at scale, as you can see by the large numbers on the screen, and we're very proud of this. Scott's going to go into more depth in terms of our product strategy and build upon that. I think the main takeaway we'd want you to see is MedeAnalytics isn't a startup. It's not new into healthcare analytics. It has existed for a long time. We have grown, we have scaled, we have exercised a variety of different technologies in the market. We subscribe to more or less the who's who of the top right-hand quadrant of Gartner in terms of technology enablement, and we continue to investigate those things from an innovation perspective, and we're very proud of the scale that we've achieved. And we think that is and will continue to be of great benefit to our network of clients. Do you want to go to the next slide, Greg?
Yes.
Okay.
Right, well, thank you, Paul.
Oh. Yep, go ahead. I was going to hand it back to you.
Oh, yeah, thank you, Paul. Well, next we're going to have Scott Hample cover our vision, technology platform, and solution portfolio. Scott?
Thanks, Greg. So hi, folks. I really appreciate having an opportunity to speak with you guys directly. Obviously, given the relationship, there wasn't, and the fact that I joined the company about 7 months ago, haven't had the opportunity to get in front of folks from the ABC relationship. And so really excited to be able to share some of our story, some of our strategy, and help get you guys thinking about what the future could be with MedeAnalytics and how to improve the value that you get out of our products and services. So before I get into that, a little bit about me, myself. I build product teams. I have been either in product management or product marketing or a general manager of a product line. I've been doing that kind of work for about 15 plus years. It's actually, I'm up to around 12 now in healthcare, both on the payer and provider side. I was also at TriZetto, which we were known predominantly for our core administrative software on the payer side, but we also had a large revenue cycle business as well that Paul talked about as well. I also have spent, the majority of my career around software as a service, enterprise software, and correspondingly analytic solutions that come out of these particular workflow and SaaS applications. So my role here is to really help transform MedeAnalytics into, a sort of aspirationally the Salesforce.com of healthcare data analytics. And so we are pushing out a lot more innovation. We are pushing out a lot more product, and you guys will be able to reap the benefits of that as clients here. So next slide, please, Greg. Thought we would start with a level set around what is MedeAnalytics and what is our solution in particular. This is a bit of a detailed schematic, but I think you guys are going to get excited when I take this through you and you can kind of correlate back to the implications of this for you yourselves and your own rev cycle and analytic strategies at each of your organizations. So going from the bottom up here, MedeAnalytics has to be good at 4 different things. The first, as Paul sort of articulated a little bit earlier, is we have to be really good at data orchestration. So you guys should be aware that MedeAnalytics is a platform that operates at scale. We take in data from over 3,000 different data sources today. We get it all in there, join it all up, and put it in a high-performing repository, because if analytics are going to be meaningful, they need to be applied across a big enough data set with enough historical trend data and things like that to be able to draw accurate conclusions. This has been one of Mede's bread and butters for 20 years, and we will continue to excel in data orchestration. Next, we're investing a lot in our platform. So more and more the products have a very universal look and feel. So whether you're on our revenue cycle products or you're on our cost and operations products or whatever you may be on, they have the same sort of UI. They have same dashboarding, reporting, and things like that. And we are investing a lot in visualization. We're working, such that we have visualization that, is on par with like your main vendors like a Tableau or a Click or a Power BI, and we're even looking and embedding some of their technologies into the Medi platform so that some of those dashboards from those, premium companies are available inside of the whole MediWorks solution. We're also going a lot farther into the predictive area, and so if you look on the right there, that thing that says MedeAlivate, we're in the early innings on this, as is everyone in healthcare IT. I was out at HIMSS a week ago, and artificial intelligence and machine learning was definitely one of the big buzzwords out there. But we are working on predictive analytics based upon machine learning here. And this is things like we could predict that a denial is going to happen, and it's based upon the following factors according to this particular reason code. And then furthermore, we are building out capabilities such that there's what's called guided analysis that goes with that. With Medi's platform, we can also say, here's why we predict it. Here's where other users of our systems have gone to take corrective action or investigate and validate that this is actually a problem. And these are ways that we start surfacing up anomalies, surfacing up issues so that you guys as users or that your teams can take actions on things that you wouldn't otherwise see from looking at a dashboard or looking at a report and those kinds of things. So we're investing a lot in the intelligent analytics area. We're also investing a lot in software as a service healthcare products. So one of the ways that we make the analytics that we offer up actionable is we want to provide all our analytics with context. So one of the ways that you have context is you create use cases around different areas. So in the revenue cycle space, our products come with dashboards, they come with reports, they come with views, with alerts. Now we're importing machine learning, MedeAlivate models that are predictive models that are specific to revenue cycle, bad debt expense, net patient revenues, AR, collections, and so there are dashboards that you can select and use to view different things. And more, as we are rapidly becoming more of a SaaS product company, there's going to be more of this functionality in your revenue cycle products. Then lastly, if you look on the right, platform as a service. We are coming out in the second half of this year with what we're calling MediWorks, and it allows us to bring in customizations for a client, or if a client wants, they can self-service, bring in other data sources that might not be in our SaaS products, build their own dashboards, or we can use it to build this on behalf of you. Build dashboards, build reports, have the views, have it all associated and sitting in the MedeAnalytics environment, and where you've already got role-based security, your users are already familiar with how to use this. And this is a way that you can rapidly customize and have things be, from a data perspective and from a UI perspective, completely interoperable with your existing Medi solutions. So that's the Medi solution, kind of what the Medi platform is. It also articulates a bit of our product strategy. In the next slide, Greg, I'll take folks through the product portfolio, please. So from a product portfolio, I talked about, we have software as a service products, and this is our product portfolio. We have solutions both on the provider side and the payer side. You guys should be aware that we're working with about 179 different health systems over on the provider side, and we're in the mid-30s in terms of a lot of the payers that we're working with. A lot of them are the who's who on each side. You guys are most familiar on the line with obviously our revenue cycle management, and that is our greatest heritage, where we've spent the most time. And we have solutions on the front, the middle, and the back end of the revenue cycle continuum. So front being patient access, middle being around revenue integrity, which gets into a lot of coding and documentation functionality and things like that, and then the back office of revenue cycle. And we have further expanded, well, let me say one last point around that is we're also coming out with a new version of this just in the end of June, and I think it would be a really good exercise for you folks on the phone to, kind of think with your account managers and do a comparison around, well, what's the functionality that's coming out, and how does that sort of reconcile with the functionality that you have on your versions today, because there might be a lot of benefit and increased capability as we look at, the capabilities that are coming out in the newest version. And then we can upgrade you and get you there. We also have gone into additional areas like cost and operations, which our clients are asking us to because of value-based care, and they really want to understand their costs as they evaluate the different risk models that they might participate in. Value-based performance, of course, is a really hot area, so we have a lot around quality measures, cost and utilization as relates to quality, population health too, getting into gaps in care, risk stratification, help improving your different care management programs and things like that. And then lastly, enterprise performance management is another area that we have through acquisition a few years ago, have a pretty robust product line around. And this is the idea of, hey, every organization has their top 5 objectives, and those objectives get cascaded into departments and sometimes right down to individual levels in terms of like goals for the year. Well, what if that was all tied to a real-time analytics or an actionable analytics platform, such that the data that was hooked to performance on those objectives was real and measurable because it was coming out of an analytics platform. We have found that makes it much more powerful. And so that's the product portfolio on the provider side. I won't go into the payer side, but we do a lot with payers as well. And we have a lot of IDNs that are selecting these products across both payer and provider side, and that way you have a universal platform. Next slide, please, Greg. This gives you, this is just your typical logo slide, but you can see sort of the different areas that we operate in and see a lot of the different kinds of healthcare organizations that we work with. So, on the health system side, it's anything from the academic medical centers to, large publicly traded to different regional health systems. In the middle, when you look at the partners, we are working, for example, with some of the who's who of revenue cycle outsourcing as well. So not only do we have a large base of health systems, but we're also with some of the largest revenue cycle services companies as well. And then certainly over on the right, with the payers, you have a lot of blues. You have large nationals like a Kaiser, who's sort of a model for IDN and other organizations. Next slide, please. So I think the last thing that we want you guys to take away is that there is confidence in MedeAnalytics as an innovative partner. I want you guys to take away that, and so I want you to see the solution and the things we're working on, and that can tee follow-up sessions with you that are more specific to your interests and how we can work and help you guys as our treasured clients. Also, I want you to know that we are a very proven solution out there in the marketplace. Analytics is a still somewhat of a nascent field, and it seems like being out at HIMSS, the big healthcare IT conference a couple of weeks ago, that everyone says they're in analytics. Well, we want you guys to understand that that despite everyone saying they're in analytics, there's not a lot of established and successful vendors out there, and we are one of them. And one of the ways that we can demonstrate that is through things like the ROI statistics that you see here. So these are things that, quite honestly, when I was joining the company last summer, we had an independent third party do an analysis of our products and get with about 40 different clients, and these were statistics that they cited back to us. And so these were all provided by clients. And, you know, I'm only going to point out the revenue cycle ones. You can see AR reduction from West Tennessee Healthcare. You can go to the next slide, Greg. I think there's more on the next slide. Yeah, so there's 7 days reduced AR, you know, 50% POS collection. I guess what I would say from a takeaway perspective is, you know, look, we have a pretty proven solution out there. I think that, you know, if you are interested in exploring ROI analysis with us, we would be delighted to. We want to make sure that you guys are getting value out of our solutions, that you guys, that your executive teams understand the value of our solutions. So, you know, part of our, you know, what we call value management process, and Kelly will go into this in a bit, is partnering with you guys to make sure that you understand our products, that you're taking advantage of our products, and that you're getting ROI out of our products. And so we would like to, you know, be able to go into such an exercise with you. Next slide, Greg. I think that's it for my section.
All right. Well, thank you, Scott. Next, we will have Kelly talk about client services. Kelly?
Thanks so much, Greg. Hi, everyone. My name is Kelly Kroliski. I am our Senior Vice President of Client Services. I want to say first and foremost that I very much look forward to working with and getting to know each of you. Working with, interacting with, partnering with our clients is definitely my most cherished part of my job. First, a little background on me. I've been in healthcare for about 15 years and have worked for companies such as Stockamp & Associates, Huron Healthcare, PricewaterhouseCoopers, and I've been with MedeAnalytics for about 8 years. I've always been on the client delivery side, whether in project management, advisory services, or account management. I also come from a family of healthcare professionals. My father was a physician, mother is a social worker, sister is a nurse, brother-in-law is a surgeon, the list goes on. So the healthcare industry is definitely a huge passion for me and my entire family. And then a little bit in my personal life, I love to travel. My husband and I have been all over the world together and have taken our daughter with us. I love to ski, and then going back to the travel, I'm also a grade A sleeper on airplanes, which is a rare and coveted talent. Next slide, Greg. I also wanted to tell you a little bit about my team and the team of people that you will come to know over the next 9 months or so. Shown on the slide are just a few individuals that you will soon meet. And I also want to let everyone know that the team is staffed by all healthcare and revenue cycle professionals. And the different members of the team have come from companies such as R1, formerly known as Accretive, MedAssets, Iowa Health, and Vanderbilt University, just to name a few. Next slide, please. The MedeAnalytics support model is very similar to what you have experienced with the advisory board company. We have a client strategy team, which is very similar to the value management team you work with today at ABC. You'll be assigned an account manager from the client strategy team who will be your primary point of contact and will work to establish regular phone calls and on-site visits with you. That manager reports to a director and vice president who you will also be introduced to and who are responsible for ensuring that you're receiving value out of your solution and are satisfied with your overall relationship with MedeAnalytics. In addition to the client strategy team, we have a help desk, which is depicted on the far right of the slide. This is our client support department who can assist with any level 1 support questions you may have, and this service is available 24 hours a day, 7 days a week. And then slightly different from the advisory board company, you will also be assigned a client analyst. The client analyst will assist with any more complex technical questions, as well as help you to submit any change requests to our engineering department. Lastly, I want to point out that we also do have a separate department for implementations. This department is called Enterprise Delivery and is responsible for the project management of all implementations, whether that be a brand new relationship or the expansion of an existing relationship. Next slide, Greg. And in terms of transition, when it comes to transitioning your support to MedeAnalytics from the advisory board company, I want to just emphasize again, like Paul mentioned earlier, that when it comes to your technology and your solution, nothing will be transitioning. You will continue to log into your solution in the future, just as you do today, as MedeAnalytics has always been the technology provider of the revenue cycle Compass solutions. What we will be transitioning is the team of individuals who support those solutions for you. and this transition will take place in waves throughout the course of 2018. When your wave first kicks off, your ABC Value Manager will notify you that the transition is upcoming and the date that it will begin. You will next receive a welcome packet from MedeAnalytics in the mail. This welcome packet will contain additional information on MedeAnalytics as a company, as well as what you can expect. Then a member of the MedeAnalytics Client Strategy team will begin to participate in your already occurring phone calls and meetings that you have with the advisory board company. From here, MedeAnalytics will work hand in hand with ABC to transition your services over time so that the transition is as seamless to you as possible. Our goal is always to provide the best service to you, and so we'll work hard along with the advisory board company to ensure that you're taken care of as we go through this change. Next slide, Greg. And this slide just outlines a couple of additional resources that are available to you. So in addition to your client strategy team, MedeAnalytics has a number of resources to help you succeed. For example, we offer a client innovation exchange in which you can connect with peers as well as MedeAnalytics subject matter experts to understand how others are using and taking advantage of product features, and even to share your thoughts on potential future roadmap items. We have regular customer satisfaction surveys that everyone is encouraged to participate in so that we can be constantly improving. And we also distribute emails containing newsletters as well as information on upcoming webinars. All of this information you can find on our welcome page, and the link to that is at the bottom of the screen. Next slide, Greg. We'll now move into Q&A to ensure that you get an opportunity to ask about anything we have not yet answered today. I want to first take the opportunity to answer some common questions that we have received thus far from a lot of you and your colleagues. The first common question we've received is, does Medi have revenue cycle expertise? And yes, Medi is the developer of the revenue cycle analytics solutions that were resold through the advisory board company under the name Compass. While Medi got its start delivering analytics for the revenue cycle, we now also offer clients access to financial, clinical, and operational insights with solutions for cost and operations, value-based performance, and enterprise performance management that Scott spoke about earlier. And furthermore, as I previously mentioned, our Medi team comes from decades of healthcare experience and has backgrounds from well-known healthcare organizations. The second common question that we've received is, what happens with my data? And I want to reassure everyone that your data is safe. MedeAnalytics is already the technology provider entrusted with your protected health information and is covered under your existing master services and business associate agreements with the advisory board company. Your data will remain where it exists today, and you will, for the most part, continue to send your data files in the same manner as you always have. The third common question is, what happens with any current conversations with the advisory board company on renewal, expansion, or implementation? The renewal and expansion conversations will continue without disruption. You might notice that MedeAnalytics team members have already started to or will begin to join those conversations to offer the appropriate support along with the advisory board as needed. And the advisory board company will continue to support existing implementations. If any outstanding implementation work remains after the completion of the transition, the MedeAnalytics team will work closely with you and the advisory board company to fulfill those services. And similarly, you might have noticed that MedeAnalytics team members have started to join some of those implementation efforts. And the last common question that we've received is, what happens to my invoicing? For the foreseeable future, you will continue to receive invoices and remit payment to the advisory board company just as you do today. And at some point in time this year, the MedeAnalytics finance team will work with your accounts payable department as well as the advisory board to transition this activity to MedeAnalytics. Your invoicing and fee schedules will remain unchanged and will reflect what your contractual arrangement is with the advisory board company. Please let us know if you have any additional Q&A. You can access the Q&A panel in the upper right portion of your screen. Please ensure to submit your questions to all panelists. And at this point, I want to reintroduce our CEO, Paul Kaiser. Paul will take the opportunity to answer any additional questions received during the course of the webinar. And again, if you'd like to submit your questions, please access the Q&A panel in the upper right portion of your screen. Paul?
Thank you, Kelly. Sure. So, Kelly, I may need your and Scott's help. There is a question already in the Q&A section around the standard questions about handouts. Are they available? and I am struggling.
Yes, absolutely. I can answer that one, Paul. So we have included, when you receive your welcome packet, which will be sent out in waves as you start your transition, that welcome packet contains FAQ, which contains all of the common questions that we've received and more, as well as the answers. So we are going to send that out to every single one of the members.
So I've used my first of 3 lifelines. Thank you, Kelly. If there are any other questions, there's a Q&A section within the WebEx Event Center. You can type your question in there, and we will do our best to answer.
I see one more question, which is, does each facility get one welcome packet? So I think, and at least I'm not sure, you might have to help me here, but I think that our plan is to send one welcome packet to each member to the primary corporate office. If you would like to receive additional materials or additional welcome packets, please make that request through your ABC Value Manager, and we'll be happy to do so.
Thank you, Kelly. Hey, if you or Scott see another question come up that I don't see, please jump in. I'm still not seeing that particular question on my screen, so thank you for jumping in. Okay, so I don't see any other questions coming up. With that, I think we'll end. I want to thank everyone for joining. I can tell you that in my first 10 months here at MedeAnalytics, I've been traversing the United States. One of my favorite things to do is get to engage with clients directly face-to-face and develop relationships. So as we go through our waves and continue the transition from ABC to the Medi support model, you can count on some engagement from this executive team. We spend a tremendous amount of time on the road, engaged with our clients, understanding the challenges and needs of the market in total, and having productive conversations around our innovation roadmap and where we're taking the company. I think it's been absolutely worthwhile, exponentially really, for us. And frankly for our client base. So I look forward to meeting each of you. Thank you for attending today, and if you have questions that come up post this meeting, you can facilitate those back through the advisory board value manager that you work with, and we're engaged with advisory board every single day, and we will make sure that we coordinate answers and get back to you in a very timely manner. So thank you, everybody. Really appreciate you joining.
And just to kind of end the session, really appreciate everyone joining. Thank you for your questions. Reach out to your ABC Value Manager if you have additional questions. We will be sending out a PDF version, like I mentioned in the beginning, so look out for an email for that. And then also we have a session on April 10th where Tyler Downs, our CTO, will present the latest developments in our technology. So look for that. And this brings us to the end of our session. Thank you everyone again for joining, and have a great day.